the Haemochromatosis Society Patient Case Studies 2018. Meet Mark Payne, 36, diagnosed 3 years ago. Mark, what led you to seek medical help?
I was trying to lose weight and suffering with quite a lot of fatigue, chronic joint pain and symptoms of depression. Numerous blood tests later, the doctor just couldn't figure out what was wrong. A couple of weeks went by again and I decided, well, I'm going to do the worst thing possible. I'm going to self-diagnose you and have a look online. And yeah, the first thing to come up was iron overload disorder. And read through that, and pretty much 9 out of the 10 symptoms I could tick off straight away. So I went to see the local genetic blood specialist at Salford Hospital, who did a full genetic screening, took some more blood tests to come back with confirmation that I had haemochromatosis.
Now, how long did all that take?
So near enough a year from start to finish. I put a lot of that down to people not understanding or knowing about the disorder and what the effects are.
And what was your treatment?
So over sort of an 18-month period, I've had around 54 pints taken from me to bring the iron levels down. It's obviously the most effective way of reducing iron levels in the blood. I'm now in what's called maintenance, so my blood levels are under 50, and I've only been twice in the last year.
You feel better now?
Play rugby now, gone back playing rugby regularly at the gym. Probably lost near enough 2 stone over the last sort of 6 months. The joint pain is eased off, which is quite good. The stomach pain have gone. From depression point of view, that's pretty much all gone now in the sense that I understand. I know it wasn't me, it wasn't something I was doing wrong, or I know that there's something in the background that was making me feel the way I felt.
So, what do you think about the support from the medical profession?
A bit of a mixed bag. I think my general GP knew nothing of it. My consultant, I've not had a great experience with the consultant. The VS nurses, or the venesection nurses at Rochdale Infirmary, where I went for well over a year, absolutely fantastic. The biggest help is the social media side of things. Certainly the Haemochromatosis Society online. I'm a member of 3 different groups, and all bring their own spin on things. But there's always a scenario that will link to yourself that you can refer to. Questions on there I wouldn't think to ask, or wouldn't want to ask, but people do, which is brilliant. So it sort of makes you a lot more comfortable and understanding.
Mark, thank you.